Today we're going to talk about chronic low back pain. Chronic low back pain is often created when there's a muscle imbalance of the lower back muscles and hip muscles. This imbalance we call is the lower cross syndrome, which is noted when the hip flexors in front of the spine are too tight, coupled with the hamstrings being too tight. It then is also seen a weakness of the abdominal area, also with the glutes. So today I'm going to show you 5 different exercises that are designed to fix that muscle imbalance and therefore allow you to have the opportunity to help your own low back issues. First exercise I'm going to show you is called the lunge stretch. In this exercise, one knee is straight down underneath the hip and the other leg is out in front of you, kind of like this. The knee is not going to be in front of the toes. And in this position, what we're going to do is we're going to stretch forward to achieve a stretch on this downside leg. You can also increase this by taking one hand up and over your opposite shoulder. Again, feeling a stretch on the front hip flexor. To the kneeling hip flexor stretch is a standing hip flexor stretch, where we put one leg out in front of us, one leg is trailing behind us, and from this position we are lunging forward to achieve a nice stretch on the hip flexors. We can increase this as well by taking one hand up and over the opposite shoulder, and therefore releasing the tightness through the front hip flexor. When we do that, that allows us to engage the glutes, which we're going to target in the next couple of exercises. The next exercise is called the side bridge. We're going to show you the beginner version first, where the knees are bent. And what we're going to do is we're going to bridge up off of our knees, also on top of our elbow, and achieve one straight line from our head, shoulders, hips to the knees, and hold that position for about 5 to 7 seconds. All we have to do then is just allow it to come down, rest for a second or two, and come right back up. Usually about 7 repetitions per side are perfect. Again, this is the beginner version. The advanced version, we simply take the legs out in front of us. I like to have my patients put the top leg in front of the bottom leg because it allows us to do a roll if so desired. Again, we can hold this for about 7 seconds, and then we'll drop it back down for 1 or 2, and then we can come right back up. Again, if you're looking for a little bit harder version, then you can also go into a roll where you side plank or front plank on the front, and then you roll to the other side, and then front plank again, and roll back to the other side, allowing for a much difficult exercise. Our third exercise is called the founder. It's been made famous by Dr. Eric Goodman, who created the foundation workout, and it's designed to both lengthen the hamstrings and the erector muscles of your low back while strengthening your glutes and getting a good targeted strengthening exercise for those lumbosacral erectors, which help prevent against so much of low back pain. So basically this is how we do it. We stand with our feet about shoulder width apart, and we're going to get back into a squat, really hinging at the hips. And therefore our weight is on our heels and not on our toes. If you feel this in your knees, you're doing the exercise wrong. So we're trying to sit back into our glutes, hold that position, and from here we're going to simply kind of pinch our shoulder blades together with our arms back. And we're going to hold this for about 15 seconds or about 3 good breaths. After this, we're going to take our arms up over our head and really try to stretch our fingertips right to the ceiling. And in this position, again, hold for about 15 seconds or again about 3 different breaths. Fourth exercise today is called a back extension. And it's designed to, again, really target those lumbosacral erector muscles at the base of your spine. These muscles help prevent against forward flexion. So most back issues are created when you go to bend forward too quickly, and then creating a back spasm or a motor movement dysfunction in your low back. So this exercise really helps to target that and really strengthen those muscles. So it works like this. We're going to get on the floor in almost like a push-up position, but from here we're going to start with our hands out in front of us. We're going to be looking at our hands and with our feet and our toes kind of basically dug into the ground. And then from here, we're simply going to bring our arms back and pinch our shoulder blades. Again, watching about 15 inches right in front of you. Holding that position for about 15 seconds, again, about 3 different breaths. And then from there, we're going to simply kind of raise up just a little bit. Again, getting a little bit more extension through your lumbar sacral spine. Hold that for, again, another about 15 seconds, and then you let it back down. And then we'll come right back up. Again, holding that position, keeping our shoulder blades nice and pinched, and then let it back down. And we'll repeat that about 5 or 6 times. Last exercise is a squat. The squat is a great exercise because not only does it strengthen your low back and hip muscles, but it actually retrains you how to move properly. Remember, most back issues are behavioral, meaning it's you creating bad movement patterns that causes a problem with your low back. So in this exercise, we're going to start with our feet about shoulder width apart, and from here we're going to work on our hinge of our hips. This is where all the movement should come from, right from your hips, not from your low back. From this position, we're going to drop back, lightly touch a chair or a bench or a bed, and to come right back up. So again, it kind of looks like this. Hips drop back, lightly touch, come right back up. Down, touch, come right back up. The knees shouldn't feel it here. It should, again, feel mostly in your low back muscles and, again, your glutes. Do that for about 5 to maybe 15 repetitions, and you'll be well on your way to helping your low back problems.